All right.
Okay, so the vast majority of people as they age, and I've said this before, we age on our face. There is no such thing as anti-aging. It's a concept that was introduced by the beauty industry so they can sell creams, they can sell products. Everybody, we see all our friends growing up together, we age. I can look back on photographs when I was in my 20s and I look different than I do now because I've aged. That's on the outside of our bodies, but we also age on the inside of our bodies.
Mm-hmm.
Inside we age, and we age at different rates according to our diet, according to our exercise routines, and the habits that we've developed throughout our life. One of the symptoms or one of the things that we encounter as we get older is osteoarthritis. You mainly find it in the hands, in your feet, in your hips, but it can happen all over the body. So osteoarthritis is normally where two bones meet. It's covered with a rubbery kind of material, and that's usually, it is called cartilage, allowing the bones to slide over each other without causing pain. Osteoarthritis comes with age, and it usually affects the hands, the hips, and the knees. The cartilage or the rubbery material has broken down, and that's what causes pain. The bones begin to rub off one another, causing stiffness and swelling. This is a photo of what your normal knee looks like. You can see the cartilage is all well placed. There's a space between the joints. The other photograph on the other side where you have osteoarthritis, the cartilage is worn down. There's spots there where it is worn down. There's a narrower joint space, and the bones begin to rub off each other, causing pain. So symptoms of osteoarthritis usually start at around 40 years of age. Commonly affected body parts are the neck and lower back, the joints at the base of the thumb or knuckles and middle finger near the tip of the fingers, the hip, the knee, the ankle joint, the knuckle at the base of the big toe. Less commonly affected body parts are the wrist, the elbow, the shoulders. Symptoms of osteoarthritis include pain, stiffness, crackling or a cracking sound in the joints, extra bone growth, decreased range of motion, meaning decreased movement in that joint, problems with alignment of joints, and they're tender to touch. You may often find that on occasion, let's say your knee may swell up a little bit and it might feel a little bit tender and hot to touch. What can you do to feel better? Rest for several minutes if the pain is when the pain is at its worst. Don't rest for too long, because if you do, you stiffen up and it'll be harder to move. If you're overweight, lose weight. Being overweight puts extra strain on the joints, and it's better if you're heavy at all or if you're overweight to lose weight. Get plenty of physical activity. Having strong muscles takes some of the strain off your joints. So the muscles around your joints, if they're strong, it will take some of the strain off it. Physical activity. If you haven't really done any physical activity, start off walking. You don't need, if you have osteoarthritis, especially in your knees, where it's common to have, we see later hip replacements, joint knee replacements, we hear about that often. Start off walking. You don't need to be running, because you're only going to be putting that extra weight and like pounding on the joints. When you start walking, don't walk according to distance. Don't say, oh, okay, I'm going to walk 2 miles, or I'm going to walk a mile or a mile and a half. Just begin on time. You're going to walk for 5 minutes this week. So you're going to do 3 or 4 days a week this week, and you're going to go out and specifically walk for 5 minutes. Next week, you can say 7 minutes. The following week, you can say 10 minutes, and just gradually build up the physical activity. Some people find that hot or cold packs can help relieve the pain for a short time. So you can also use assistive devices depending on the immobility that the arthritis is causing. Now, this is what we're talking about today is osteoarthritis. We're not talking about rheumatoid arthritis. They are two different conditions. Osteoarthritis, you can get some devices. Talk to your doctor about that. Your doctor will probably refer you to maybe a physical therapist who can do some little exercises with you as part of an assessment of balance, mobility, range of motion, and they can recommend what assistive devices. Things like shoe inserts, splints on joints, canes, walkers. Learn about your arthritis, learn about osteoarthritis from the different there's a lot of different government websites out there. The Center for Disease Control and Prevention, the CDC, which we heard more about around COVID, they have numerous topics on their website, including osteoarthritis, that will give you a wealth of information. And it is written at the level of a layperson's understanding. It's not written at the level that it would be for the doctors or nurses to understand. It is written at the level of a layperson's understanding for the purpose of health education and preventative health care. So you can learn about your condition, you can look at the symptoms that they describe, look at the symptoms that you have. I have some pictures here on the slide of the different devices. Your cane and your walkers, it's very important that they get sized for you. It's usually a physical therapist that will size that for you. The people that sell the walkers, they may also be able to size it for you, but you also need, we see this a lot where people will borrow, oh, I think I need a cane. Let me borrow, oh yeah, my nephew has a cane or my brother has a cane. I'm going to take his cane. Don't do that. Try, okay, bring the cane to the doctor's office with you, and they will get somebody at the office to show you how to walk with the cane, how to walk properly with the walker. The picture of the walker that I have here on the slide is the one with the seat on it. I've chosen that picture specifically because if you really need a walker, the seat is very handy, because you're not necessarily going to forget the walker. You can sit on the seat. It's not like you place the walker to one side and then you forget to take it with you across the room. And you may need one in your own house. You don't want to leave it by the sofa, get up, go out to the kitchen and fall. You want to be able to take your walker with you, and having that seat on it just gives you that little reminder you're not leaving the walker somewhere. And again, with a cane, you want somebody to show you how to walk with it properly. And I know we've all seen it where people have a cane, they're walking along, they don't maybe need it all the time. Maybe they do well without it, but they're outside, so it's better that they have it with them and they have it off the ground. They're actually holding the cane and it's up off the ground. That's not doing you any good at all. And the purpose of all of these devices is so that you have less swelling, less pain, and that you don't fall. If you need a cane to walk, use the cane to walk. If you need a walker to mobilize, use the walker. Remember, fall prevention is the purpose of these assistive devices, especially the walker and the cane. Another little bit, and I'm sure people might end up being sick of me talking about herbs and supplements. There's no strong evidence that supplements of any kind work for arthritis symptoms, including osteoarthritis. There's various products out there, glucosamine, and Codrotin. Check with your doctor before you ever take any herbs or supplements, but there really is very little, if any, evidence at all out there that they actually work. If you want to try supplements or herbs or herbal preparations that you get from a health food store, I'm not saying that you shouldn't try them. Of course, try them if that's what you feel will help you, but please let your doctor know. Check with your doctor, check with your pharmacist, check with whoever you need to check with to find out that it's not going to react or interact with any other food, medication, or food or medication. One of the things that's coming to mind for food is your medications being taken with grapefruit juice. Be very careful there, because there are some medications that don't get absorbed if they're taken with grapefruit juice.
I learned that recently too, and I was surprised. I had no idea.
Yeah.
Yeah.
And then the other one that actually gets absorbed really well is your iron tablets, or your multivitamin will be absorbed better if taken with orange juice. So there are a lot of both positive and negative food interactions, as well as interactions with herbal medication and your prescribed medication. The way to avoid that is to let your doctor know what you're taking. And in more recent years, in the past 5 or 10 years, the doctor's office will almost always ask you, are you taking any over-the-counter supplements or herbal medications?
Because people don't consider that when they're like writing down their medicines a lot of the time, right?
That's right.
Yeah.
They don't, because it's over the counter, the perception is that you don't need to list them. You do need to list them. And the other perception is that there's no harm in these medications, but you need to list them. You need to let your doctor know, because they can interact with some of your prescribed medications, and they can interact positively and negatively with other foods as well. And your doctor, your nutritionist, or at the doctor's office, it's a dietitian. There are a lot of different, and I'm not discounting them by any means, but there are a lot of people that are nutritionists. They call themselves nutritionists. They may not necessarily be what we consider professional health dietitians. The dietitians are the people that know the chemistry of foods, what interacts with what vitamins to take, what you need to take. If you're taking fat soluble vitamins, how much fat you need to take in order for them to be absorbed. You could be taking fat soluble vitamins and not taking any fat, and you might as well be putting Smarties into your body. It's not going to do you any good, because it's not going to get absorbed. So these are medicines that you can take to ease your arthritis. Osteoarthritis, again, is what we're talking about. Doctors will usually suggest physical activity, increasing your physical activity, weight loss, and perhaps using assistive devices first. Then they may suggest that you have some treatment to relieve the pain. Usually the treatment only works for a few weeks, or you may get some relief for a couple of months. And it depends on the severity of pain that you have. If you have mild osteoarthritis, physical activity and weight loss will most definitely improve it. But the physical activity needs to be consistent. And it's basically changing a habit where you just have to incorporate physical activity, walking, into your lifestyle. Some people can get surgery, and we've all heard of that. They can also put injections into the bone, and one of the slides here shows that. Down at the side, for instance, in osteoarthritis of the hip, they can inject cortisone shots and other medications into the area, and it usually gives relief for maybe anything from 6 to 8 to 12 weeks, depending on the person. Surgery, of course, is an option. Knee replacements, hip replacements. We have heard of people, multiple people that have had very successful hip and knee replacements. The key to mobility for your surgical implants or your surgical repairs, your replacements, is the physical therapy afterwards. Your mobility is very, very dependent on your mobility, your healing, everything is extremely dependent on that physical therapy that you really receive afterwards. Do exactly what the physical therapist tells you to do. Do the exercises at home that they tell you to do, and you will have a full, very good recovery after these replacements. If you don't do the physical therapy, your recovery will be in direct proportion to the physical therapy that you do afterwards. And that all goes again towards physical activity, exercise, movement, mobility, needing assistive devices, all of that. But you really do need to do those physical exercises that they recommend you to do afterwards. Gout. So gout is another form of arthritis. It can cause pain and swelling in the joints, most often seen in the big toe. It usually only affects one joint, and more often than not, it's the big toe. And you can see on the picture here, it's red, it's inflamed, it's hot to touch, and it is extremely painful. So you can have gout, it's there. It's not painful all the time. It's during gout flares or flare-ups that it becomes painful. The flare-ups last for a week or two, and there can be long periods of remission in between. Symptoms you can see on the slide here. We're looking at the shoulders. Intense joint pain suddenly comes on, usually in the middle of the night. Joints are swollen, red, and warm to touch. It does mostly affect the big toe, but it can occur in the ankle or in the knee and in other joints. Triggers. So gout occurs from a buildup of uric acid in the blood. It crystallizes, the uric acid crystallizes in the joints, causing inflammation and this flare-up. It can come from, the flare-ups can come from alcohol intake, high sugar intake, high purine foods, and we'll go into that, what they are later, and certain medications. Treatment is non-steroidal anti-inflammatories. Now, that is for the vast majority of the population. Your Motrins, your ibuprofens, they're all Aleve, they're all non-steroidal anti-inflammatories. If you have any kind of kidney disease or anything like that, you need to check with your doctor what kind of anti-inflammatory type of pain medication you can take. If you're taking steroids or colchicine, they're going to be on prescription anyway. But if you have kidney disease, you won't be taking the non-steroidal over-the-counter Motrin, you would be taking steroids. Elevate and rest the affected joints. You can use ice therapy, avoid alcohol, sugar, and high purine foods. They're foods that have high amounts of uric acid in them.
Do we know why it often presents in the big toe, the joint of the big toe?
No, not really.
Yeah, it's just,
it just seems to be, most people seem to get it in their big toe.
That's so interesting that
but you can get it in other places.
Yeah.
It is
joint,
interesting.
yeah. I'm just curious as to why. Yeah.
I'm not too sure, but I can find out if there's any. I can look up and see if there's any research on why it's the big toe.
Yeah.
Anybody I have ever encountered that has gout, it's always the flare-ups seem to be in the big toe. Now, the uric acid is everywhere.
Sure.
So the flare-ups for gout is in the big toe. The other thing that uric acid can cause is stones, kidney stones.
Oh, interesting.
Yeah.
Okay.
So people who have too much, where it comes from, people who have too much uric acid in the blood, it's a chemical that's produced when the body breaks down certain foods. It's a very sharp needle-like pain. People describe it as being extremely painful. Uric acid crystals can form in the tubes of the kidney, and the tubes of the kidney carry urine from the kidneys to the bladder. And these crystals can turn into kidney stones. They can cause excruciating pain and problems with the flow of urine. The pain of kidney stones is excruciating. Thankfully, I personally have never experienced it, but I've heard from people, from patients, it's just really painful.
Yeah.
So there are stages of gout, the progression of it. The uric acid is building up in the blood and it begins to form crystals around the joints. And you can see where the crystals are forming on this slide. The second stage is acute gout. So the difference between acute and chronic, chronic is there all the time. Acute gout is referring to those flare-ups. It's an acute flare-up, an acute incident, and it needs to be treated, and then it can go into remission. It doesn't mean that you don't have gout. It just means you really have chronic gout, but you don't have the flare-up where you have the really bad pain. So the acute gout, the symptoms begin to occur, causing the painful attack, those flare-ups. Intercritical gout is those periods of remission between the flare-ups or between the gout attacks. And chronic gout is gout pain is frequent and the trophy forms around the joints. Symptoms of gout.
What do we got here?
We're doing a presentation if you'd like to come in and listen.
This I got to see. Even though I'm more of a car guy, but I just like to see what this is about.
Talking about osteoarthritis and
Okay.
gout.
So the symptoms of gout. So you get sudden flare-ups or attacks of severe pain. Most often in the big toe, your ankle or your knee. And the gout flares tend to happen more at night. It'll flare up more at night and the affected joint can turn red and it can swell. You can see this here in your big toe.
That's gotta hurt.
It looks painful, doesn't it?
Well, it's not the thing that happened to me once. Let me tell you guys. When I was 8 years old, I actually broke a bone. This one, the right toe bone, the big one. Yeah, that happened when I was 8 years old. I had to wear a cast for 3 months. It was not good. at
Would you
all.
like to sit down
If
so
you'd
we
like to
can?
sit down and I'll explain this to you.
Mhm.
So inflammation and redness is the main symptom. Obesity, sedentary lifestyle is more inclined to cause more symptoms if you have more obesity and you're not really exercising a lot. 4 to 6% of the population suffer from gout. They experience severe pain, especially at night. You can use anti-inflammatory drugs as for your painkillers, steroids we talked about. Excuse me, harmful products or things that will produce a flare-up are things like meat, beer, red meats. We talked about alcohol already. Uric acid is the cause of gout. And if the kidneys do not excrete enough uric, they don't excrete the uric acid, so it stays in the body. And because there's too much of it, that's where we get our gout. Foods that should be avoided during gout. So if you have gout, these are the foods that are high in uric acid. Fatty fish, shellfish, meat, eggs, caffeine, they increase the production of uric acid. During an attack, while you're having a flare-up, avoid white flour, yeast products like bread, alcohol, wines, your red and white wines, but avoid all alcohol because they will produce more uric acid, which you're not able to excrete, and that's when you'll get your flare-up. Do not consume leafy green vegetables like spinach, cabbage, broccoli, and keep away from cakes, pastries, and sugar. We mentioned sugar, we mentioned alcohol, and your high purine foods, meat, fatty fish, eggs, and caffeine. Just be very aware, it sounds like a lot of everything that you would normally eat, but just be aware that they can induce a flare-up because of their high uric acid content. So if you go to your doctor, you're complaining of a pain in your toe, there is a test that the doctor can do. It's a sample of fluid that they take from the joint that's in pain. And typically they'll find crystals, uric acid crystals in the fluid, then you have gout. They don't always do that test. Usually the symptoms can speak for themselves. Flare up, big toe, swollen, red at the base of the big toe. And the symptoms and the pain that you described is almost always enough for them to diagnose gout, because it's very specific and it's very, like I said before, it is most often seen in the big toe, where not everything else is seen as much in the big toe. Yes, you can get osteoarthritis in your big toe, but it isn't going to look like gout. It's not going to have that hot, red, inflamed look to it.
Severe
as well as the
pain.
pain.
Yeah.
The blood test will, any of your blood tests will show a high uric acid level, which they can just, you know, you're going to the doctor, you're saying about this, they might be doing a complete blood count on you anyway. They might do a chemistry and they can say, oh, take a uric acid level. It's easier than putting you through an aspiration of your big toe. Treatment for acute gout and for gout flare-ups. The non-steroidal anti-inflammatories, corticosteroids, and colchicine are usually the medications that they give. Colchicine might be one a day and go on for a few weeks. Your non-steroidal inflammatories and your corticosteroids, that will kind of be short treatments until your initial flare is alleviated. And in recurrent gout, 2 to 3 weeks after the flare-up, you may be put on allopurinol, and that kind of will keep it'll give you more remission time and it'll keep the flare-ups at bay.
Wait a minute, what is alcohol anyway?
Well,
And that what one you said, Pearl.
oh, it's a type.
Allopurinol, it's a
Yeah.
medication that the doctor would give you.
Didn't know that.
Does anyone have any questions?
If you have gout once, are you definitely going to get it again at some point? Okay.
Yeah. And you really have to, I mean, the way to avoid getting flare-ups
Right,
is to try to avoid those foods.
those foods, or like heavy intake of those
heavy
foods.
intake of those foods.
Okay,
Just be aware of it, be aware of the kind of foods you need to try to avoid
Mhm.
so that you don't get flare-ups. But the allopurinol, most people that have gout are usually taking that medication all the time, and that helps with the excretion of uric acid,
Okay.
but it doesn't get rid. I mean, you could still be eating or drinking a lot of that, and the allopurinol won't help you. You may still get flare-ups. You
Right,
still
it
have
just-
to be very aware. You want to be aware of the amount of uric acid contents you're putting into your body.
Yeah, yeah. And then so people get gout because, or am I understanding this right, is what I'm asking? People get gout because for whatever reason, they're either taking in too much uric acid or their body cannot expel it, or a combination of probably potentially both of those
Yeah.
things.
Yeah.
Okay.
And like I said in the beginning, as we age, these
Mm.
things come to the surface.
Mhm.
And it's that whole concept of aging. Aging is very good.
Mhm.
There's many of us feel very privileged to be able to age.
Right,
We all know people that didn't get the opportunity to age.
right.
So you just have to be more aware of what that aging can cause in your body.
Sure.
So, you know, the old expression, moderation in all things.
Yeah, right.
Moderation, you know, and for the younger people, they're not as aware of what can happen as you get older,
Yeah.
but as our bodies age, they're not able to do the things they could do when they were younger.
Before.
So when you're younger, develop those healthy habits so that you'll have more longevity and more quality of life
Right,
with your longevity.
right.
It's usually older adults, older seniors, older adults that get gout,
Mhm,
that get osteoarthritis,
mhm.
that have your knee replacement. Yes, we've seen some athletes have knee injuries and various things, but it's not as much as we see osteoarthritis and gout in the older population.
Sure, sure.
Well, I want to ask a question about this gout thing. Have you ever got it before?
No,
No, that never happened.
I didn't get it. No.
Well, you never know. That might happen over time.
Okay.
Hopefully
It
not.
may do, hopefully it won't, but it may do.
Mhm.
Let's continue on, shall we?
Yes, of course.
Yeah,
Okay, so
Yeah.
that's the end of the presentation.
yeah, very
This is the end
good.
of the presentation.
Yeah, thank you, Mary. Yeah, I'll stop.
Oh, so you make it better.
Yes.
Let's make do.
Thank you so much.
Mine definitely. I'm a big car guy on these
Oh,
parts.
yeah. Here, do you want,
What is this?
it's a